therapy is gaining more and more attention, but one of the most common questions is safety of stem cells. Today we will ask the most frequently asked questions from patients about stem cell safety to Swiss Medica's doctors. Let's start with a question many people are worried about. Is it safe for patients with cancer to undergo stem cell therapy?
So stem cells are working great for improving the regeneration and the growth of new cells, but also they stimulate the growth of cancer cells.
Since the stem cells they have a regenerative effect that is applicable to every tissue in your body, give or take. So if the patient is already having an active tumor, then there is a risk of it getting worse because it will benefit from this regenerative potential that they are giving. Hence, it will grow faster.
So for patients who have the history of cancer diseases, we are very strict with all the documents that we need to take from the patient to be sure that this will be safe for him or her.
But if patient has no tumor, has no oncology, it is impossible for stem cells to produce the tumor.
There are cells which increase the risk. They are fetal and embryonic stem cells, which are got from in vitro fertilization embryos which are not used, or from aborted tissue. Most of world clinics are not using these cells due to ethical reasons and humanity. We as well, we never use these embryonic and fetal stem cells.
Some people fear getting infected from donor cells. Where do stem cells come from? And if we use donor cells, can they cause infections?
So this is really a very important question because it's the biggest issue with the safety.
Typical sources of the mesenchymal stem cells that are being used in the clinical practice, they come from three major sources. First, it's bone marrow. Secondly, it's adipose tissue, and thirdly, the least used is dental pulp. In our clinic, we mostly use bone marrow and adipose tissue cells. So that's one thing. Secondly, if we talk about the donor cells, one of the major concerns obviously are infections because, yes, this is a transplant, it's a donor transplant, it's a cellular, yet it's a donor transplant. So people are worried about the contamination, the rejection, reactions, etc.
We take the stem cells from healthy donors. These are healthy pregnant women who have a natural birth, and children have any problems with their health. No infection diseases, no genetic disorders. Everything has to be perfect. Then we take the sample of these stem cells, usually it's placenta or umbilical cord.
Secondly, we will check our cells after gathering, and even after we put them into cryobank, we will follow up stories of our mothers and children from whom we obtain cells.
We are using the European GMP protocols, which have certain rather strict demands about the quality control and about sterility and all this stuff.
How do you check the quality and safety of donor cells?
There are three main stages of these checks. First of all, as I said, it is medical history of mothers and children who are donors.
If mothers are enlisted in our programs, they are being checked themselves for infection, genetical problems, etc. After the delivery itself, we transport birth material, umbilical cords, placenta into our lab, and we do all the necessary prerequisites. We double check everything.
And we are using the PCR method to control for the current and final control of the stem cells, which detects the single molecule of the bacteria or virus or fungi or mycoplasma, for example. Of course, if something is detected, these cells are not used.
Each cell line has a certificate where a patient can take a look what tests were done with the cells. So all the laboratory tests, all the vitality, genetic testing, infection disease testing are included to this certificate. So patients can be sure that having donor stem cells in our clinic is safe.
Stem cell treatment, like any other treatment, affects the immune system of patients. At this time, it is extremely important to avoid infections. What measures are taken at Swiss Medica to minimize the risk of in-hospital infections?
There is a good clinical practice guidelines on how you should organize the work in particular hospital. So we are upholding all of them. We have high standards, hygiene, in sterility, in all of our treatment procedures.
If a person has an infection disease, the stem cell treatment may be not that effective as it could be if applied to a healthy person. So before we start the actual stem cell treatment, we do some testing prior. So we check the blood count to be sure that there are no signs of inflammation. We check some biochemical markers also to be sure that our patient has no metabolic disorders and no long-term lasting consequences from infection disease. And if we see any signs of infection, then first we treat the infection, we fight the inflammation, and only after that we start with the stem cells infusion.
Many patients are concerned about side effects after stem cell treatment. What side effects patients can expect from stem cell therapy? And how do they know if they need to contact a doctor?
As any other kind of treatment, mesenchymal stem cell therapy has its own side effects. But the main positive feature that there are no long-lasting side effects.
If the treatment is effective, that means that it definitely may have some side effects. We can divide them into short side effects and long side effects.
The symptoms are mild and transient. Usually after the administration itself, people can feel low-grade fever, flu-like symptoms for a couple of days. Plus, since the stem cells are having a stimulative effect on the neurological tissue, patients tend to be a little bit more agitated, a little bit more irritable for a week or two, but that resolves itself on its own. If there are intrathecal injections in the plan, a patient can feel a headache.
In total, about 10–15% of the cases, there are some minor side effects.
Talking about autistic children, they may have anxiety and they may have some flu-like symptoms after the infusions. And the long-lasting side effects for autistic children may be increasement in hyperactivity. This usually lasts for 1 to maybe up to maximum 2 months.
This is due to the fact that the stem cells are improving cell-to-cell contact in neural system due to regenerative effect upon the neural cells, and it leads to a rapid increase of information which is coming to the brain, and overwhelming of the brain. So that's why the brain can't digest all this information.
And for adults, only if a person has some specific disorder or specific coexisting disease, we can suggest that probably they will have some side effects from the stem cell treatment. This is usually discussed personally with a patient according to his specific condition.
Also, our patients should know that we follow up our patients. Even after they will discharge from our clinic, we will follow up them remotely, and we will invite them for checkup programs to be sure that our treatment is working properly and they have no even a slight shadow of any side effect.
Today we addressed the most important safety concerns about stem cell therapy. If you still have questions or want to explore if stem cell treatment is right for you, visit our website to book a free consultation. See you in the next video on Swiss Medica channel.